Ralph Major arrived at KUMC as chairman and professor of pathology in 1914. After study in California, Baltimore, and Germany, it was a homecoming of sorts for the native Missourian. He was one of 3 Johns Hopkins educated faculty members, including Thomas Orr and Harry Wall, at the beginning of the 20th century. Dr. Major was fluent in multiple languages and was known as an outstanding clinician. He wrote the 2-volume A History of Medicine in English and then translated it into German himself. In 1922, he was one of 3 practitioners worldwide to receive the very first doses of insulin to study its use and determine dosing levels. After being chairman of pathology, he became chair of internal medicine and then chairman of the Department of History and Philosophy of Medicine. In that role, he often spoke of the history of the school and of the personalities he had known.
And I hope it doesn't seem too autobiographical, but when you have taken part in a history, as I have in the University of Kansas School of Medicine, it's very difficult not from time to time to be autobiographical. You've probably heard the old saying that if 2 doctors get together, they start a medical society, and if 3 of them get together, they start a medical school. This may be a slight exaggeration, but it does have a remarkable kernel of truth in it. Does anyone else have any special individual? Of course, I love to talk about these people because they're all my old friends who have long since parted this life, and I like to recreate them and hold them up for admiration of a later generation, because men have done some things, many of them, that should never be forgotten.
Dr. Major set the bar quite high for accomplishment in a medical career, and along the way attracted many devoted students, residents, and doctors who considered him their mentor. Among these was Dr. Mahlon Delp.
I became very well acquainted with Dr. Hashner and with Dr. Major and Dr. Logan Clendenning when I was in the medical school, so even from my sophomore year, I think I really thought I would go into internal medicine, or at least I would follow Dr. Major in his department somewhere. I was titillated a little bit by surgery because I liked Dr. Orr, and he made a good pitch towards recruiting me. a much better pitch than Dr. Major did, which bothered me a bit, but I still wanted to go into medicine.
So of the 3 men you mentioned earlier, I assume you're singling Dr. Major out as having a special influence.
Oh yeah, sure. Well, as far as I'm personally concerned, he was the physician of all physicians. He was the teacher of all teachers. He was the outstanding man in the medical school from its beginning up to date, and I suspect for the next 100 years he will still be the man of greatest stature as far as this medical school is concerned.
Later in life, Dr. Major became Dr. Delp's patient, and following a massive stroke, he died at KUMC in 1970.